The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, today on Aging Horizons we're going to be talking about 211. Not 411, not 911, but 211. And it's a community resource that helps people get connected very easily with different resources that they might need in their local community. And it's spreading fast. We want to tell you about it. Stay with us.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting. But it's different now. I want to be here for her and for my daughter.
When I stopped showing up, Jim showed up at my door. He took me to the hospital in town to get me help. That's the day Jim saved my life.
Everyone has a role to play in preventing suicide. Know the signs and don't be afraid to speak up. If someone you know is in crisis or emotional distress, the only wrong thing to say is nothing at all. Call 800-273-TALK or text MT to 741-741.
Every generation produces heroes, men and women who step forward to defend our country in time of need, no matter the personal cost to themselves. And though we can never fully repay them, we can make sure they have access to low-cost, long-term care when they need it. That's what Montana's Veterans Homes are all about. If you've got a hero in need in your family, call us. We can help.
Hi folks, and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Kimmy Everman, and today we're going to be talking about what I think is a really exciting project going on around our country and definitely in Montana, and it's the 211 number, just a local resource number that very easily is going to be able to connect folks to linkages and resources that they need in their community. We have a couple of very special guests with us today. First of all, we have Brenda Ludwig. Brenda is the 211 manager for United Way. Brenda, welcome.
Thank you for having us.
Certainly. And we also have Mandy St. Aubin, and Mandy is the Development and Communications Coordinator for Help Center, Inc. Welcome, Mandy. Nice to have you.
Thank you for having us.
Sure. And Brenda, let's start with you. Let's just talk a little bit about Montana 211 and what it's all about.
So as you mentioned, Kimmy, Montana 211 is a phone number that you can dial, but it's also an online resource directory that helps people get connected to services in their community, whether it be assistance with housing, perhaps someone needs food assistance, and we also have resources available during the COVID-19 pandemic.
Wow.
In addition, so we talked about the resource directory is www.montana211.org. And then it's also a phone number, an easy to remember phone number. Like you said, you don't dial 411.
Right.
You don't dial 911, you dial 211. And that will help you get connected to trained professionals. It's a confidential number that you can dial to help you find services in your area. At this point in time, there are 36 counties that have call service access. And our hope is to have it in all 56 counties of Montana. As we get more funding, we'll be able to do that. The website is available for anyone that has internet access.
Yeah. Well, and it's a big project, so it's a little slow going, I bet, for here and there. And we're going to put a coverage map up on the screen so folks can kind of see what you were talking about. And again, it's really to help Montanans connect with resources.
Correct. And actually, 211 has been around for quite a few years.
Oh, has it?
Actually, we'll have Mandy talk about that as well, but it's been a hidden gem in our state.
Yeah. Well, and Mandy, that's a great segue for us to move over to you. So Montana 211 is a part of the national system, so you take it from there.
Yeah, so 211 doesn't only exist in Montana, so it's a part of the national 211 system. And all of the call centers that take the 211 line are accredited, so you know that you are getting high quality help when you do call. It did start in 1997 in Atlanta, and then it sort of spread from there. And we've had Montana 211 since 2005. And there are 240 call centers in the whole United States. So it continues to grow. And it started with 4 nonprofits and continues to be upheld and ran by 4 nonprofits. So it's with us in Bozeman at the Help Center. There's Voices of Hope in Great Falls, the Human Resource Council in Missoula, and then United Way of Yellowstone County that Brenda's a part of. Yeah. So continues to thrive with those 4 nonprofits, getting it across the state.
It's so exciting to hear it spreading across. I didn't even realize it was in 36 counties, Brenda. That's awesome. How long have you guys worked on this to get it to this point?
So
we've been doing it since 2005 is how long we've been working on it all together.
Yeah, you said that. I'm sorry.
That's okay.
And, just with a couple of minutes left in our first segment, I guess one thing I'd like to hear from you, Brenda, what do you think is the best part about 211? Because I'm excited about it and think it's a great tool.
I think the best part is it's consumer friendly. It's easy to use. It's non-stigmatized. For those people that need help and are afraid to ask, they can call the telephone number and receive confidential service. And then also just to be able to go to the website to find the resources as well. For those that, it depends on the population, but some prefer to pick up the phone, whereas others prefer to go on site to find those resources.
And the phone is 24 hours, 7 days a week, right?
Correct.
Okay. Mandy, please jump in.
I think just for those that do have the call service, just having an easy to remember number is super convenient. Just like everyone knows 911, we hope that everyone will know 211.
Right.
And so I think that is really nice. And for those that don't have the call service, being able to hop on the website, and like Brenda said, it's very user friendly, not super complicated to use, and so I think that's what is really nice about both the online version and then also being able to call. Right.
Do you think that people are people starting in Montana to recognize that we have 211?
Definitely. We are seeing that, just based on the website traffic that we've had. There were about 34,000 views on the 211 website last year. And I know call volume has increased as well.
That's just great. Well, we'll talk more about this because I have a lot more questions to ask you. Folks, 211 is just a really great resource, and it's going to connect you up to local resources and contacts and make your life easier. Stay tuned. We have a whole lot more to tell you about.
I was diagnosed with diabetes in 1992, and I went into denial. It made me angry. I was a professional chef, and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
Good care is your right. In Montana, there's over 11,000 beds in nursing homes and assisted living facilities. If you or a family member needs assistance or help in obtaining information about care issues and placement options, call 1-800-332-2272. If you or a family member need information about Montana's long-term care resident rights, or if you need help solving a problem or a complaint about a nursing home or an assisted living facility, call us at 800-332-2272.
If you give or receive care, you already know that it can cause stress on caregiver and receiver alike. The good news is, if you have limited resources, help is available. The Montana Lifespan Respite Program may be able to help you pay for care while you take a break. Even better news is how easy it is to apply. You can get an application online or have one sent to you. We'll get back to you within 5 working days. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Montanans are independent. We're also responsible, protective, and committed to our families and communities. That's why we've done so well against COVID-19. As we open up, we've got to keep doing what we do best. And it starts with each and every one of us, protecting public health in the 406 for our families, friends, and neighbors. We all have to do our part. Montanans get that. And we've got this.
Hi folks, welcome back to Aging Horizons. We're here talking about 211 today with a couple of really expert folks. We have Mandy St. Aubin and we also have Brenda Ludwig. And Brenda, we're gonna kind of start with you this segment and just talk a little bit about some of the initiatives that you all are working on.
Sure. So we had the privilege of working with the Mayor's Challenge to Prevent Suicide Among Service Members and Veterans. And that was in Yellowstone County in Billings, and then our Mayor Cole, and then with Mayor Wilmot Collins in Helena. And so part of that project was they wanted to incorporate Montana 211 into that as a resource for service members and veterans and their families to go to find services with the hope that we would prevent suicide if people are accessing the help that they need early on. And oftentimes there's so many other stressors that people are having. You know, they might be having trouble paying their rent, which then could lead to a crisis. And so in working with that, we had great success building our resources in those two areas. And then now we're working on the Governor's Challenge. And so that is also suicide prevention for service members and veterans. And we're building resources statewide for that population. And we're very excited to be a part of that as well. And in addition, on the 211 site, we'll show you in a bit what the site looks like. But there's also a diabetes education and prevention program that we've worked on with DPHHS, where you can go to the health and medical section of Montana 211 and find those services as well.
Those are just absolutely fabulous pieces to this puzzle. I think anybody who is a regular Aging Horizons viewer knows that we talk suicide prevention frequently here. And in Montana, it's a big issue. And so to have all the different organizations sort of trying to pull in and support that is pretty wonderful, I think. So I didn't realize that was part of the 211, so that's really cool to find out. And also the diabetes, I mean, that we know is also a huge problem, especially for some of the folks in our state. And what a great way to sort of weave in the support that people might not even know they need. but there it is for them. So Brenda, thank you so much. That sounds great. Mandy, what about you? In addition to 211, I know that the Help Center is involved in some other stuff.
Yeah, we have a lot going on in Bozeman at the Help Center. I did want to point out that on the 211 website, we also have a mental health care provider directory. So, and this is for statewide. So anyone can go to the Montana 211 website and look for a mental health provider by searching in their area. And a lot of counselors are offering telehealth. So that means they'll provide counseling or mental health support over the phone or over something like this, like Zoom, or over the computer. So be sure to check that out. There's a lot of great individual providers out there that can help, in addition to community organizations that provide mental health support as well. I did want to point out that so the Help Center, in addition to 211, and along with Voices of Hope in Great Falls, we are the state's 24-hour crisis lines, and then we also answer the National Suicide Prevention Lifeline. So if you call 1-800-273-TALK, depending on which area in Montana you're in, you'll get either routed to us in Bozeman. We cover southwestern Montana, and then Voices of Hope in Great Falls covers the rest of the state. So just so that people are aware, when you call that number, you don't get routed someplace else. You get routed to us within the state.
Great. And Mandy, that's confidential, right?
Yes, absolutely. So when you call that number, it's confidential, and we're here to listen and help and support and help you get through that crisis or whatever you may be going through.
Right. Because I think one of the things we talk about on this show a lot with many different subjects is the stigma that can be attached to some issues like this. And certainly needing to reach out because you're suicidal or depressed can often bring stigma. But you're saying, no, go ahead and reach out.
Yeah, we're available 24/7. So anytime that you feel like you just need someone to talk to, even if you're not in, it's not a high crisis or anything like that. We're just here to listen. Right. And then also if you're worried about someone, so there might be someone in your life that you're concerned about and you're not quite sure what to do, we would welcome your call as well, just to help you get through and help you support that person get through that crisis.
And Mandy, you mentioned that these are trained professionals that we're talking with on the telephone. So these are not just folks from just anywhere. These are folks who really are trained to know how to help someone in a crisis.
Yeah, so we have both us and Voices of Hope in Great Falls. We have staff, paid staff, and we also have volunteers. Everyone goes through a minimum of about 40 hours of training, if not more, depending on their interests. So they're very trained. We provide lots of support to make sure that everyone is ready and able to answer the phones. And when they are, they do a great job.
Super. Well, we have still more to talk about. So you two stay with me. Don't go anywhere. And folks, again, this is a service for you, for your family and friends. Reach out. No judgment, no stigma, all confidential, and you can get some assistance in your time of need. Stay tuned. We have more to talk about.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
I'm Attorney General Tim Fox. Nowadays, all of you have to worry about cybersecurity. Something as simple as visiting pirate websites can put your computer at risk. Hackers use pirate websites to infect your computer and steal your ID and financial information, or even take over your computer camera without you knowing it. Don't let hackers into your house. Be careful with the websites you visit and warn your kids on how to stay safe online. To learn more, visit my website,
Sergeant Jones. Please respond. I was separated from my squad. Requesting backup. Anyone? Please respond. I'm all alone here.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Hi everyone, and welcome back to Aging Horizons. We're here talking about 211 today, which is a community resource that's quickly spreading across our state as well as across the United States. We have with us Mandy St. Aubin. Hi Mandy, glad to have you. And we also have Brenda Ludwig. Brenda, again, nice to have you. And Brenda, you were going to talk to us just about, 211 is really for everyone, isn't it?
It is. 211 is for everyone, whether it's someone that needs help paying their rent, perhaps they need a home repair. As I talked about, we have services listed for veterans, service members and their families, also our senior population, children and families. There's just something for everyone on the site. And it's so important to us to help Montanans get connected to the resources that they need. And we understand that it can be very overwhelming for people at times.
Right.
So by calling 211 for those areas that have call service, we have trained staff and volunteers that are there to help. If you're in an area where you're unable to call 211, you can go to the Contact Us page of the Montana 211 website and locate somebody.
And we're going to put that up on the screen, Brenda, so we can just talk about that for a second, because I know that you feel really good about how well organized the information is. Tell us a little bit about that.
We do. We have worked so hard on the website to make it user-friendly. It's a mobile-friendly website. And when you go to the site, when you pull that up, we have what we call hot buttons or quick access buttons, where you can really drill down to those areas that you're looking for. So if you're looking for housing assistance, you can click on the housing button. If you need food, you can click on the food button. It's just very, very easy to navigate through.
And is the website, I know that we have 36 counties that actually have the 211 service, but any county is represented on your website though, correct?
Yeah.
I mean, it doesn't really matter where you live, you can look there.
Absolutely. So all of the counties in Montana are on the 211 website.
Okay.
And it's possible that maybe there aren't resources available in that area. And Mandy will talk about more about other resources that are available to people. But definitely, if you have internet access, a computer, phone, internet access, you can go to montana211.org.
Super. Well, Mandy, let's talk about some of those.
Yeah, so when you go to the website, you search by the area that you're in. Mm-hmm. And sometimes, especially maybe in a smaller community, you might feel like you know about the resources, but there might be some statewide or national resources that you weren't aware of. So we encourage you to just check it out, search by your area, by whatever your need is, and you might be surprised what is out there. And again, if you need some help and you don't have the call service, feel free to pull up the Contact Us page and take a look, and you can call our local numbers and we can help you through whatever you're looking for. And just a reminder that the website is available 24/7 at montana211.org, or you can call 211 as well.
So if somebody reaches out to you locally, they're getting a trained volunteer or staff person who is going to listen first and foremost, right? And then what happens?
Yeah, so we listen to what is going on in their lives or what their situation may be. And then we start identifying resources that may be able to help them with that. And oftentimes, we give out a few resources, and then we'll follow up as well, just to make sure when you did call the resource, did you get a hold of someone, or did the resource not work out? So we try to help you through that crisis or whatever you're going through to make sure that you find the resources that you need.
Right. And I think it's important to remember that you just said crisis. And if there's ever a point where a person can reach out prior to it being a crisis, you're there for that too, right?
Yeah, absolutely. Yeah, or even you just are curious about a resource, or you're something is coming up, or that in a few months rent might be an issue. Sure. Calling us and trying to get ahead of that information is really important. But yeah, if you just need someone to talk to as well.
So Mandy, I'm going to ask you first, and then Brenda. We've just got a couple minutes left. What do you think is the most valuable part of this project for you?
I think that you don't have to go out there and find the information on your own. You don't have to use Google. Yeah. 211 does a really good job of organizing all of the information on the website. Or if that is overwhelming, or you can't get on the website for whatever reason, calling 211, and then let us help you kind of do the work alongside you and find those resources for you. So I think it's supportive is the thing that I love the most about it.
Great, thank you. And Brenda, what about you? What do you think is the best part of this whole project for you?
I echo what Mandy said, but also, it's a one-stop shop. You help, as we mentioned, there's resources for just about everything that are listed on the site. And when you call 211, they'll get you connected to those as well. It just makes it easy. You can get all the help you need in one phone call or on one visit to the website.
One-stop shop. Everybody likes that. Ladies, thanks so much for being with us today. Mandy, Brenda, we really appreciate it, and thanks for all the hard work. This is a great project, and we'll have you back, I hope.
Thank you. We hope to come back.
Sure. Folks,
thank you.
211 is a really important project. It brings together community resources and contacts that you may not even know exist locally for you. We want you to reach out. Even if all you need is to talk to somebody, that's a biggie, and you can do that too. For Aging Horizons, I'm Kimmy Everman. Thanks for being with us today.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.